evening everybody, respected chairpersons, seniors and my friends. Today I am going to present the topic, the effect of Kutaja Pratisarani Akshara in the management of Ardhra Arshas. Coming to the introduction part, Arshas is considered as one among the Ashram Mahagada as told by Sushruta, and the Pratisarani Akshara, which is treatment for Ardhra Arshas, does Chetana, Vedana, Lekhana, Karma, and Arshas which are suitable for this are indicated for this Pratisarani Akshara are having Mrudu, Prasruta, Avaghada and Uchrita. Those are all fit for Pratisarani Akshara. Coming to the sampling method, I grouped 40 patients of Ardhra Arshas were randomly categorized into two groups, of which each comprises of 20 patients. Coming to the inclusion criteria, patients with the signs and symptoms of Ardhra Arshas, that is Pittaja and Raktaja Arshas, Arshas which are Mrudu, Prasruta, Avaghada and Uchrita are taken, and first and second and third degree internal bile masses were taken. Coming to the exclusion criteria, fourth degree internal bile masses, patient with carcinoma of rectum and anal canal, patients with other systemic illness like uncontrolled diabetic mellitus, HbS-AZ positive, uncontrolled hypertension, HIV and ulcerative colitis, and external bile masses. Coming to the assessment criteria, assessment was based on the subjective and objective parameters. Subjective parameters like pain, bleeding, defecation, and the objective parameters like size of the bile mass, rate of sloughing of bile mass, change in color of bile mass, and tonicity of the anal canal, that is sphincter tonicity. Coming to the treatment duration, I grouped group A and B. In A, it's taken as Apamarga Pratisarani Akshara, that is standardized Pratisarani Akshara, was applied to the bile mass in single sitting and managed with Panchavalkala, Vata 6 bar and Vayam Taila, that is Estimadu Taila for 7 days, Pichu. Then in group B, Kutaja Pratisarani Akshara was applied to the bile mass as the same, similar like Apamarga Pratisarani Akshara in a single sitting and managed with Panchavalkala Vata 6 bar and Estimadu Taila Pichu for 7 days. We can see here, before treatment it is a second degree bile mass, and during the treatment and after the treatment it is exactly Pakva Jambu Phala Varna games. Then this is a comparative study, so I have taken that paired and unpaired t-test, and the statistics were done based on SPSS software version 16. I have taken the parameters: pain, bleeding, defecation, sloughing, color, tonicity of the sphincter tonicity of the anal canal, and size of the bile masses. The p-value of pain is greater than 0.05, bleeding greater than 0.05, and so it is statistically not significant. The defecation, sloughing, color are highly significant because the p-value are defecation 0.001, sloughing 0.001, and color is less than 0.001. And coming to the sphincter tonicity, it is less than 0.001, so it is also significant, and size also highly significant in group A, that is Apamarga Pratisarani Akshara. And in group B, in pain and bleeding are non-significant statistically, and whereas defecation, sloughing, color, tonicity and sizes are also significant highly statistically. Compared with both the groups, it is stated as defecation and size are statistically significant, whereas remaining are not statistically significant, because both Apamarga Pratisarani Akshara and Kutaja Pratisarani Akshara shows very good effect towards the patient. Coming to the discussion parts on the effect of the therapies, the post-operative assessment was done on the criteria of pain, bleeding, defecation, sloughing, color of the bile mass, sphincter tonicity of the anal canal, and size of the bile masses. This taken a daily follow-up for 7 days and up to 1 month weekly follow-up, and 3 months once follow-up 2 times up to 6 months. And after 6 months follow-up recurrence rate, the results of follow-up study showed no recurrence in both the groups. Comparison of the effects, on the basis of comparison of the effects, the application of Kutaja Pratisarani Kshara provided better relief as compared with Apamarga Pratisarani Kshara in pain, bleeding, defecation, slumping and size of the bile masses clinically than statistically. Conclusion: post-operative reduction in the size of the bile mass is less number of days in Kutaja Pratisarani Kshara when compared with Apamarga Pratisarani Kshara. It is both clinically and statistically. In this way, Kutaja Pratisarani Kshara may be considered the more efficient drug in the treatment of Ardhra Arshas as compared with Apamarga Pratisarani Kshara. Thank you for giving this opportunity to present here.